So in this second of the two screencasts, we're going to spend a few minutes thinking about how you treat PCOS. And the ideal is always going to be a one-stop clinic where you've got the consultant, a gynecologist, obstetricians, a nurse specialist, and a dietitian, so that the patient can come to hospital once and be seen by all of those people and have that holistic support. That's the ideal. It's not always what happens. The support group Verity is a really important aspect and something that people should be aware of, because there's a lot of resource on their website, but also because they put people in touch with other people who are struggling with the same situation that they are. So there's a lot of support that can happen through that. So let's have a look at some of the evidence around the care for people with polycystic ovary syndrome. So this document comes from Australia. So we'll come on to the nice guidance in a little while, but this just is a bit of an evidence overview, and a bit like we've looked at grading. If you notice here, we've got evidence-based recommendations, we've got clinical consensus recommendations, and clinical practice points. So where there isn't evidence, then it's based on what clinicians together have come up with as thinking is best practice. And some of the clinical practice points are more to do with that holistic understanding of person-centered care. So the first thing is the lifestyle intervention, and we're looking at diet, exercise or physical activity, and behavioural strategies for all of those living with PCOS and excess weight, and to support reductions in weight, reductions in central obesity, and better insulin resistance. So that's evidence-based. The way that is delivered, healthy lifestyle behaviours, healthy eating, regular physical activity, is something that should be recommended. Trying to maintain the healthy weight, optimise hormone outcomes, quality of life. Everyone is in agreement, and that's a clinical consensus. We need to look at achievable weight loss goals, and you've really got to think 5 to 10% may still have somebody in an overweight category, but we've got to be realistic about someone who has cravings, who's going to struggle, whose body is fighting against them really for weight management. We've got to be realistic about what can be achieved. So that would be the starting point. And of course, patient-centered. So there's a lot of behavioural techniques that can be really helpful, and we need to be mindful of those and work with the service user to deliver those. So goal setting, self-monitoring, controlling stimulus is those things that tend to lead to people to eat when they don't need to, help them to solve problems, perhaps give them some assertiveness training, slowing eating down is a really important thing, and reinforcing positive changes, supporting relapse prevention, and so on. There's lots of them. And a lot of women with PCOS will also have cognitive behavioural therapy to try and help them, particularly if they're struggling with their mental health, to give them more control and to help them to problem solve themselves. So there's lots of positive interventions that can be provided. From the dietary aspect, a variety of healthy approaches can be undertaken to decrease the energy and try and produce the weight loss. And it's not necessarily a one-size-fits-all method of doing that. Of course, you want healthy eating. Everyone's agreed with that. And ideally, you're going to be looking at some kind of energy deficit to support weight loss when it is needed. So we don't really know that one particular way of doing this is better than another. So really what you're looking at is, who is this individual? What is impacting on their eating behaviors at the moment? What, cultural aspects, faith aspects, what foods are going to be right for this individual. So we're going to be adjusting and working with them, what works best for them. The physical activity aspect, we should be encouraged out for everybody anyway, but it's particularly important for women with PCOS to support their weight maintenance, weight loss and maintenance. So we're looking at 250 minutes per week of moderate intensity, or 150 of vigorous intensity, or that mixture of both. Muscle strengthening, of course, as well, and reducing sedentary behavior. So the physical activity aspect is really important because of the difficulties with controlling food intake. SMART goals, self-monitoring. So those things we've already mentioned. So what should we do with women who are living with obesity? They need much more regular monitoring that we normally give to people living with obesity. We need to be mindful of any body image concerns and concerns with self-esteem, and to try and prevent weight gain as early on as possible, ideally from adolescence. If we look at some of the medications, we're not going to discuss the hormone medications, but looking at some of the medications that you might be familiar with. So, and look, these points are all evidence-based recommendations. So metformin can be, could be recommended for adult women with PCOS, so not for teenagers, but for adults, to try and support weight management and the metabolic, better metabolic outcomes. We still want the lifestyle changes, and certainly if women are overweight, that makes sense, and we would encourage that. And it could be considered in adolescence if there is a clear diagnosis. So there's lots of things to think about there, but these are evidence-based recommendations. I'll come back to this. Orlistat, is that going to be a useful adjunct for obesity in women with PCOS? And a clinical consensus recommendation that could be included. There are other things to be considered, of course, and particularly the possibility of pregnancy. So you've got to be mindful of the contraindications for using something like Orlistat. So those are the recommendations from the evidence-based perspective, but this is a nice guidance. And this is what we need to think about, from a UK perspective. So they're suggesting that we screen for anything that might be related, any other causative factor for all the symptoms. It's really important that women are aware of the long-term complications. And when we're working with women with PCOS, we need to be coming from that positive side of this will help you to keep well. This is a health promotion guidance as well as a treatment for what is happening at the moment. So we've got encouraging a healthy lifestyle, weight management, and here again, explain the link. Why are we doing this? Why is weight management so important in this situation? And it's because it helps with the symptoms. So it reduces the hyperinsulinism and the high levels of male hormones, the androgens, reduces the risk of type 2 diabetes, cardiovascular diseases, improves the menstrual cycle, and therefore improves that chance of pregnancy. So that's really important. We would definitely want to be providing sources of support, and there is quite a lot of information out there, and there are a couple of support groups. It is the 2nd of March is PCOS Advocacy Day, so it's trying to get the needs of women with PCOS up the agenda a little bit more. And I say Verity is very much a support group as well, to try and give someone to talk to when they're struggling with this condition. The BDA fact sheet on PCOS has recently been updated, and just to give you the highlights of that, I guess, they're encouraging regular meals, which makes sense from linking in with the insulin resistance. Low GI carbohydrates and whole grains, again, makes sense from that. Balanced meals, omega-3, again, with people at cardiovascular disease risk, that makes sense. The weight loss and the physical activity. So all makes quite a lot of sense, fitting in very well with what we know. The other thing to think about is how you support somebody to deal with cravings. And sometimes cravings are because people feel their intake is constantly restricted. Sometimes it's emotional. And we've got to kind of support people with that. So if you reduce carbohydrate too much, which you might do if you were thinking, well, shall we try and prevent type 2 diabetes? What you can do is increase the cravings and increase the chance of binge eating. So working on the physical activity is going to help to balance that. These cravings can last up to 50 minutes. Now, for people without PCOS, cravings normally last about 20 minutes. So 50 minutes is a long time to work through and distract yourself from the desire to eat something. So, encourage hot drinks, fruit, vegetables, those kinds of things that are going to not have that negative impact. Distractions, getting people to think, right, how much do I really want this thing? And am I hungry? Or is this a craving? And trying to balance those two, and decide therefore on what action to take based on whether it's hunger or not. So I mentioned metformin earlier, but the reality is it's not licensed for PCOS. Of course, if someone has diabetes, then it can be used, but it's not licensed for PCOS. Orlistat can be used if weight management is required. So it's going under that license rather than a PCOS license. Clearly, some women are going to need statins, and the other medication is to do with trying to correct that hormone imbalance, and that might include contraceptive pills which block the effect of the male hormones. So the summary, there is no cure for PCOS, sadly. Treatment goals are based on managing symptoms and that health promotion or prevention of complications developing. There's a lot to be considered around infertility and preconception advice, which includes weight management. We're looking at reducing the risk of developing type 2 diabetes and cardiovascular disease and the weight loss. So it's going to be that combination of treatment. So there's a lot that we can do to support women living with PCOS, but it's not just a dietetic thing. It is definitely a medical problem to be managed as well, and potentially with some psychological support. So I hope that's been helpful to give you an idea of PCOS, so that should it happen on placement, you should be at least familiar with what the condition is. I've just given you a few references to look at as well.